Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Wednesday, February 10th, 2021, time for our COVID-19 update. I enjoy bringing good news each time, and Greg's already on there, more good news. Yeah, we're getting better news. You know, the numbers continue to go down. From a health system standpoint, we've increased the number to 17 we have in the hospital. We have a couple more ICU patients and a few more on the floor. But the numbers and just being overwhelmed, we weren't where we were 2 weeks ago. Now, we're a little worse off than we were a week ago, but we're still seeing that little gap from where we were in January when the health system as a whole and across the whole South was strained. So we're seeing some relief. I will emphasize it's not gone away. We're still seeing 17 people today in the hospital with COVID. Some are very sick. We still have people on vents. We still have people coming in the ER who need quick action. So I would encourage you to continue following the protocols that we have followed for the last 10, 11 months and fixing to be 12. But from a numbers perspective, things are starting to get better. And when you look at overall, you can see the 7-day hospitalization there is going down. And as we are today, we were at 11.02 of the 8th. So you can see over the last 7 days, we continue to see that going down. This is Region F, which is Titus County. We're in that one. This is the Tyler area south of us at 12.03. And then the Dallas area, you can see they're getting closer to that 15% mark at 15.69. And that's through February the 8th, so those are updated numbers. So you can see them continue to go down across northeast Texas, so we're glad to see it. From a hospitalization perspective, the northeast Texas RAC that we're a part of is at 121 hospitalized patients with COVID, 50 in the ICU, so a little more. I talked about what we're seeing is consistent, what we're seeing across the region. I noticed we used 6 remdesivir doses yesterday, and it was one of the higher numbers in the region. As a region, we only used 25 doses yesterday of remdesivir, which is a high potent antibody that's used in the hospital for inpatients. We used 25 in the region yesterday, 6 by Titus. We were using 125 to 150 a day at our peak a few weeks ago as a region. So to see that number at 6 for us, we're up over some of the other facilities that are a little bit bigger than us, but you can see those numbers, they're manageable at this point. From a Tyler perspective, you can see hospitalizations continue to go down. They're at 354 versus 453 just 10 days ago. So almost 100 patients down in the hospital, and the ICU down about 35 patients, which is good to see from their perspective. Same thing in the Dallas region. You can continue to see the Dallas region go down and about the same percentage in numbers down in the ICU as well, from 754 to 637. So from a numbers perspective, there is some good news, and you're starting to see it across the region, but we can't stop. And one of the things that we're doing is we're continuing to get the vaccine. We started making the phone calls yesterday. Our dosage arrived late last night, so we started making the phone calls today. We are not calling and scheduling until the doses are on hand, and that's one of the things we're having to be careful of. We don't want to get people scheduled, have them come in, only to find out they didn't arrive. So we did start giving vaccines this morning and giving those out. We have 1,000 first dose, and we have 200 second dose that we're giving out. We talked a little bit about the last week on Monday, and you saw the week in the paper, the second dose. We're getting a lot of phone calls from our week 5 and week 6 shipment that people had their second dose, worried about getting their second dose. It was becoming the number of days, 28 days was hitting this week or next week, and they haven't got an appointment. I just encourage everybody to remain patient. As the state sends us second dose, we're getting them out. We have 200 that are going out today, tomorrow, and Friday. And Monday, we're starting to call people, getting them the second dose, and you'll get those calls. We hope the state will have, on Friday, we'll get our allotment from next week, and it'll be more. You have 42 days, is what the state's telling us right now, 6 weeks from your shot to get that second dose without any issues. And there are studies coming out that it could possibly be longer, but right now it's sitting at 42 days or 6 weeks to get that second dose. So all I can do is encourage you to be patient. As TRMC receives a second dose, we're giving it out. There are some rumors and there's some news articles I've read about people giving second dose as first dose, and the state's against that. We are following the state of Texas guidelines for giving the vaccinations in hope that by following those guidelines, we'll get more. And that's all we can hope. And we're working with the right people to get more. One of the questions we had the other day that I just wanted to pass out there, we talked about, I think it was Greg who asked on Monday, what about when can you get this after having COVID, you're COVID positive, when can you get it? I did talk to Dr. Thurman, who is one of our hospitalists here at Titus and over the inpatient rehab, who works closely with our hospitalists and intensivists, and has been on, I think, over 400 plus COVID calls since it started last March. He works with Dr. Yates, our infectious disease doctor in Tyler. And, after your symptoms go away, if you test positive, after your symptoms go away, 14 days later, you can get the vaccine. And that's the recommendations coming from those physicians. If you test positive, after your symptoms go away, 14 days. Now, if you did receive the monoclonal antibodies, BAM, Regeneron, or any of those IV drugs, it's different. It's 90 days from when you received it. My mom had that when she was COVID positive. She had that IV 90 days and when she can get hers. So I encourage you, if you've had COVID positive, work with your family care physician, your PCP, talk to them. If not, talk to the nurses and they'll help you work through it. But as we continue to get those doses, I can promise you we're getting them out as quick as possible. My wife's watching, so that's always fun to see. I love her too. Heart to my wife. She gave me a heart. Please get into the wait list. We have that up there at TitusRegional.com. It is up. So the people who try to get on Monday night and got that under maintenance, our apologies. We did get it fixed out. We're trying to improve that website to give you an update and an email as well. So more to come on that. Trying to do more just to get that communication out there. Working on some things, hopefully over the next few weeks, that will speed up the process and continue us going. As we move into February, we've talked about being Cardiovascular Month. I am excited about on the next 2 weeks away, on February 25th, from 5:30 to 6:30, we have the Heart and Vascular Community Town Hall. We did a town hall virtually a few weeks ago with Dr. Stagg and Dr. DeLisi, and it was very well received. And we were able to get quite a few good questions. With COVID right now, over the past year being around us and everywhere we go, really wanted to get our cardiovascular physicians an opportunity to address Northeast Texas and talk about COVID, talk about the heart, and other things that are going here in Titus. So cannot think of three better physicians to have to talk about it. Dr. Abbas, Dr. Sekulich, and Dr. Siegel. So join us on February 25th at 5:30. I'll have the opportunity and the pleasure that night of moderating it. So I look forward to that. And I look forward to learning. Cardiovascular disease is the #1 cause of death in Northeast Texas and in the United States. So whatever we can do to help prevent that, we're looking forward. So join us on February 25th, and you'll see more coming on our Heart and Vascular Community Town Hall. So I'm going to end today on just a good note. And, it's been a great year. And a lot of things are going on, and I've just been so blessed by all the people at the health system has do so many things. It's been a rough year for many of us, and tomorrow is my mom's birthday. So I just want to say happy birthday to my mom, and on behalf of my dad, who can't say it for himself, me, my wife, and my boys, happy birthday to Betty Scoggin tomorrow, February 11th. She's a Valentine's baby, so we'll be celebrating her birthday tomorrow. Socially distanced, of course, but we'll be celebrating her birthday. So glad to have her in town. Glad to celebrate that with her. Please join us on Friday. Tell you about how dinner went with my mom. We talk about what I had for dessert. But join us on Friday as we talk about Valentine's. We can get ready for the weekend on Valentine's, and we'll give some special shout out with Valentine's Day being this Sunday. Again, thank you for joining us. I appreciate your questions in the comment. We'll try and address those questions during Fridays and Mondays, so keep them coming, or drop us a text or drop us that. So again, thank you for your support of Titus Regional. God bless.